Okay, my name is Aaron Bodette. I run MedicarePrepare.com. You can take a look at the website if you'd like. I've been in the Medicare health insurance business for over 30 years, and I'm happy to help any way I can. I put together this informational content so you can understand how things are working in 2022. It's usually pretty relevant. Figures change every year. However, it's a very linear structure, or at least it has been for many, many years. If you didn't watch my other video on how Medicare Part A and Part B work, I suggest you watch that prior to watching this video, which is going to be about Medicare Part C. I realize this isn't so simple to read, it's complex, and I have a very small board. However, you can always stop, pause, go back, rewind, send it to your friends, whatever you'd like. So in the last video, I explained what your responsibility is under Original Medicare. If you go with Medicare Part C, it's also called Medicare Advantage. They are synonymous. An insurance company is going to take over all the administrative responsibilities for Medicare. Medicare says they have to be as good as, if not better than, Original Medicare. That's how they work. People engage in these programs for a number of different reasons. Many programs, maybe not many, several, I see a lot of them have zero premium. They have no premiums. So while you're paying for Medicare Part B still, $170.10 a month, you're paying zero for Part A. For this plan, you may not pay anything. And at least it gives you some benefits that are kind of attractive, if you ask me. Days 1 through 60, Medicare pays everything but $15.56, as I said in the last video. How does Medicare C work? Well, maybe it depends upon the plan of the company and the market that you're in, because they vary by county and company. Maybe you have a copay of $750. Another plan may have a per day cost. Maybe you're responsible for $400 a day for 5 days. Maybe it's $350 a day for 6 days. They vary. So I suggest that you look around, to see what's available. And then I'll tell you how I look around for my clients, because it's a very specific manner in which I hunt for these things. I use the process of elimination. I'll go over that in a little bit for you. So how much will you pay? If you're paying $400 a day for 5 days, what happens after day 5? Well, typically you don't pay anything anymore, and you have unlimited days in the hospital. If your copay is $750 fixed, what happens? Well, after you pay the $750, or whatever that copay is, typically you pay no more, and it again has unlimited days in the hospital. I've seen plans that with this $750 that also has a $1,000 deductible. I've seen a variety of these programs. If you have both Medicare and Medicaid, I've seen this at zero. If you have what they call a dual plan, which we'll talk about a little bit later. So basically what these Medicare Advantage companies are doing is they are reassigning all of the copays, all of the values here that Medicare Part A doesn't actually pay for. They cover it, they just don't pay for it. So they reassign everything, and they give you unlimited days in the hospital. Now, it should be noted that when your hospital and your medical combine, if that out-of-pocket cost to you reaches an out-of-pocket maximum, this varies by company as well. Typically I see $7,550. I see it lower. If it reaches this threshold, then the Advantage company pays 100% of anything else for the remainder of the calendar year, because all of these plans renew on the first of the year, every year. Sometimes they change, sometimes they don't. Usually they change a little bit. Skilled nursing. If you get usually the first 20 days, you pay zero, because that's what Medicare covers. From days 21 to 100, these plans, typically you pay the $194.50 a day. Not all of them. I've seen plans that do cover some of this. I haven't seen a plan that covers all of it, but maybe it does exist and I haven't seen it. There's so many plans I can't know them all. I will tell you that at roughly $200 a day, you would reach this threshold of out-of-pocket in a hurry, but maybe less than 40 days. So basically, if you reach this threshold, they're going to pay for the rest for the calendar year. That's the out-of-pocket maximum for the hospital and the medical. Now, since the Part B, which is the medical portion of Medicare, went over in the last video, has a deductible of annually of $233, most of these Advantage plans, at least the ones that I'm attracted to, they don't have a deductible. So you don't usually have to meet this. Instead of going 80% to 20% you pay after the deductible, again, these Advantage plans, they reassign all these values so that if you go to a regular doctor visit, maybe you pay at your general practitioner, maybe you pay $0. Maybe you have a $5 copay. Maybe it's $10, maybe it's $15. They vary. If you go to a specialist, maybe you pay $30 or $35 or $40. I've seen $50. If you have an MRI or CAT scan, maybe you pay $150, $200, $250. They really vary. So you never know without looking at the benefits, and that's why it's helpful to have somebody, like me, or that can help you go over your options if you're shopping for, a Medicare Part C. It should be known that not all of them have zero premiums. I've seen $50, $30, $80. I've seen $200 premiums. I've seen $300 premiums. Some of them actually reduce. They have I call it a negative premium. They call it a give back, where it reduces what Medicare takes out of your check every month. So that varies as well. These are all components that you should consider. I know I'm going fast. You have a pause and a rewind button, so you can go back. Some of the other benefits that these Medicare Advantage plans, the Part Cs, typically add, not all of them, dental, vision, gym membership, hearing aids, and the ones that I like, they add Part D. Not all of them add Part D. Many of them add Part D, so it's kind of like a buffet. You're getting a little of this, a little of this, a little of this. I'm going to have this side dish of hearing and dental. You know what I'm saying. There's a lot of items on the buffet table. You take what you want, you use what you don't, and use what you want, you leave what you don't. But you're paying for all of it. And the Part D on these programs is very interesting because not every company covers every drug. Medicare has a set of drugs. They have, drugs they cover, drugs that they don't, and not every company covers them all. So that's usually the first thing I do. I mentioned the process of elimination. The first thing I do is I look up your drugs, because if you have certain brand name drugs or combinations of brand name drugs, they may be not covered by some plans, and even if they are, they may be treated much more favorably at another company. And if they're expensive, this can be of significance, because the drug plans with Medicare, the way Medicare has the rules set up by which these plans and Part D plans have to operate, is much different than traditional under 65 commercial insurance. We'll go over that in another video. But it's also, my process of elimination is predicated on, a specific pharmacy. Perhaps you have to use, Joe Smith's pharmacy because, you know him, he's been your neighbor for 35 years, and this happens. So if you need a specific pharmacy, and you're taking a combination of drugs, we plug them into the software and we find out. Or we can just look at the major pharmacies and see where it may be most attractive for you to shop. That's part of how the process of elimination works for us. Once we figure out the most attractive place to get your drugs, especially if you're a diabetic, because those drugs can be very expensive, and especially in combinations, we then look at the doctors you like to use, because typically there are preferred networks in these Part C plans. They come in, a number of varieties. HMO, where you must use doctors in a network unless it's an emergency or urgently needed care, where you go to the nearest place. Where they have networks. The HMO, you have to use a network. The PPO, they do have a network where you can go within the network. You can go out of the network. Your copays and your cost sharing is typically higher, and your out-of-pocket maximum on a PPO is usually higher. I think it goes around $12,000 right now on many of them, not all of them. These aren't hard and fast rules. I'm giving you a 5,000-foot view so you know what to look for and you understand how Part C works, why it's attractive, and why people consider these types of programs. Questions, post them here, email me, medicareprepared.com.